At the end of 1 year in this model, look where that aggregate number went. It dropped by 32%. And you can see, again, largely a sustained reduction over time. I had a guy once years ago said, well, never did get it down to zero. I thought, well, you idiot. Whose healthcare costs go to zero and stay there? So I still say, if you had the cure for cancer, there'd be some idiots walking around. I don't want it. Reminds me, I'll go back when I was talking about the importance of those 5 steps, and I said I'd save a story. There was a firefighter in Asheville in the early days, and he told me he did not have a glucose meter anymore, and I asked him why, and he said, well, I didn't like paying my copay for them strips. He said they're expensive. He said, so what I did for a while was I cut them in half to make them last longer. He said, but they got stuck in the machine and it broke. And I thought, well, there's good reason to die young. People will do the dumbest things with their own health. Had another, well, I'll save that for later, I'm sorry. I digress here. If you look, though, inside those silos, look at the yellow strata. That's where the shrinkage is occurring. That's doctor and hospital costs. Now, you indicated, both of you, that your healthcare, are you all physicians by any chance?
Pharmacists.
Ah, excellent. I feel very warm to pharmacists. They've become some of my best friends. No, and I asked only because if you were a doctor and in the early years of Asheville, you saw this and then this, what do you think they said?
Yeah.
Well, this is not good. Pharmacists are usurping physicians. They're practicing without a license. And that was all translated to, we ain't making money no more. I was smart enough to know, let's just face reality, politics is politics. If I interrupted the patient-physician relationship in healthcare, this was DOA, it would have been buried and never heard of again. We went back to our data and found something that we have found every time this has ever been replicated over 100 sites nationwide to date. My people in that first year had over 200 more outpatient visits than the year before. Well, I'm not real bright. I scratch my head and okay, wait, John, you're giving away drugs with a boatload. They're getting these ACE inhibitors and other important drugs. They're seeing the doctor more frequently. I'm paying pharmacists a fee that I'm paying for patient education from diabetes educators and nutrition. Where am I saving money? And it was a doctor who helped me understand. He said, John, I don't charge as much for an outpatient visit as I do to see them in the ICU or the ER. And my roots kicked in. I thought frequency versus severity. I can afford more frequent preventive care than I can afford less frequent, or in the case of disease state patients, even more frequent, acute chronic care. It saves money. Now,